Hi, everybody. This is Sue Ann Jackson. It's 1:30. We're going to go ahead and get started. Welcome to the webinar. This is the 2015 ongoing monthly ADRC webinar series that the State Unit on Aging does. We're happy to have you guys joining us today. We're recording the webinar as we usually do, and we will post it and the PowerPoint on the SUA website within the next couple of weeks. We will be muting everybody. I think everybody's muted already because that helps us with background noise and static. So if you have questions or need to check in with us about something or have comments about what's happening, you just need to use either the question or the text chat feature. So either the question or the text chat feature. Okay, let's see, what else? If you're a group site, please either email or text chat the list of names, and it might be easier, depending on how many are there, for you to send us an email. We're pretty excited today. I have here with me Christy Murphy, who's my teammate and coworker, who's going to talk about the ADRC and what is that old ADRC anyway. But I just want to let you know that Lori sent out the PowerPoint this morning in an email to everybody that was registered. We hope you got that. If you didn't get it, you can quickly shoot her an email right now at lori, lori.c.watt@state.or.us, and just in the subject line say, I need the materials for the webinar, and she'll get them right off to you. And then after the webinar, within the next hour after the webinar, just watch for an email from Lori with a SurveyMonkey link so you can let us know how we did. And with that, I believe we're going to go ahead and get started. So I'm going to let Christy take over and talk with us.
Good afternoon, everybody. Thank you so much for signing up and for joining us today. I really am going to do this what is the ADRC thing anyway. We have a real diverse audience today, so I just want to say for some of you, this may be a very, very high view, but I think I've always found it's best to start at the very beginning. I'd like to encourage you as we go along, if you have questions, to go ahead and text them in on the chat. Is that right? Mm-hmm. Yeah. And we will do our best to answer them for you as we go along. Okay. So you can go ahead to the next slide. So we're just going to talk about the ADRC, and I just want to throw in a little personal experience of mine that I wanted to share with you. Is 23 years ago when my mom, I wasn't in this business, and my mom had had a major stroke. And I found myself trying to find the best care possible for her and her situation. And it felt at times, actually most of the time, like I was on an island with no map. And everyone on the island spoke a completely different language than I did. And at the end of the day, I would say, why is this so hard? Trying to find the best care I can for my mom, and it's just difficult. And that's what actually brought me into the aging, into this work. Because I thought if we can streamline things for folks to make it easier, we should be doing that. And so I was really excited to be included in the ADRC and the development of the ADRC statewide. So that's just a little bit about me and about how we have our work cut out for us. So first of all, I just want to talk about a little bit of history about the ADRC. In 2003, the Administration on Aging and the Centers for Medicare and Medicaid began making grants available to the state. And I was really shocked to find this out because Oregon has always been such a leader, and we didn't get our first grant until 2008. And that was the Real Choices Grant was the name of that, and we started an ADRC in Lane County. So Lane County was our first pilot site. In 2009, we received another grant, and with that grant, we expanded the pilots to include Lynn, Lincoln, and Benton counties, and then Marion, Polk, Yamhill, Clatsop, and Tillamook. And so we picked those areas because they were all contiguous, they were all connected, they were down the valley, and it was 30% of the population. And we began, it was kind of like we were developing, building, and flying this ADRC all the way along. With that grant, we really did focus on developing infrastructure for the ADRC. We knew that at some point we wanted these to be statewide. And so with that grant, primarily we set up our public-facing website, our call module, where we enter all consumer information when they call in. And it also contains our care tool for our options counselors to enter the information on consumers regarding options counseling. We also set up, we really focused on training. First of all, making sure that our information and assistance folks were getting trained in the program called the Alliance of Information
Referral Specialist.
Yes, Alliance of AIRS training, Alliance of Information and Referral Systems.
Specialist.
Yeah, and so that was the main focus because we really wanted to take those INA folks to the next level. Oftentimes in agencies, information assistance specialists are an entry-level position, and really educating those folks on how to interact with the caller to get the particulars, what they're really searching for, and to identify any other unmet needs. We also created, in partnership with Portland State University, our options counseling training curriculum. It's what we use today. Of course, there's been a few changes and reiterations, but essentially that was developed with that grant too in 2009. So those were the main pieces on that grant. In 2012, we received another enhanced options counseling grant, and that's really when we began to really roll it out statewide to all the areas. So I can tell you today there are 9 ADRCs across the state. They're in various stages of development, but most of them are up and running. Our last one to open its doors will be the Central Region, which is, you know, that whole center swath from Hood River down to Klamath Falls. But they're on board to go live the first part of August. Okay, so what is the ADRC anyway? The direction from CMS and the Administration on Aging at the time was we have this huge population turning 60 in the next 15 years. We really do need to create highly visible, highly trusted entities that provide information and services for seniors, people with disabilities, their families, and their caregivers. And I think the key piece is highly visible, because while we've had these entities in our community, we know that people have not known where to go to get help. Also, we really want the ADRC to be the first touch people, the first contact people make when they have questions regarding any of these things. And again, it's letting people know where to go.
And it's actually a national initiative, so that not just in Oregon, we talk about it everywhere. So also we help consumers find resources and make informed decisions to maintain their independence. And so when someone calls the ADRC and they have questions, if it's a very simple question, the INA staff will answer that. But if people need help with virtually anything, finding programs for healthy aging, finding resources for whatever their need might be, the ADRC is the one who can do that. And the ADRC isn't one entity. The ADRC is really a coordinated network of existing organizations. So what we're doing is we're taking all these organizations that serve seniors and people with disabilities and bringing them together to work side by side. They'll maintain their roles and their identity, but they're all working under the ADRC umbrella. So currently, the core partners of the ADRC are the area agencies on aging, the Centers for Independent Living, the Aging and People with Disabilities offices, which are the Medicaid offices,
And as we move forward in this whole ADRC concept nationally, we're seeing that we're going to start adding new partners. One which will be folks with developmental disabilities, veterans, mental health, and the list continues to grow. So as the ADRCs get up and running, there'll be more agencies that will be brought under the ADRC umbrella. So what is the Aging and Disability Resource Connection of Oregon? What we're trying to do is really create that one stop, that one place to go to get information and services. Again, like I said before, we know that people have a really hard time knowing where to go. And we know this because we've done forums, community forums in various communities with AARP. And I remember in one specific area asking this group of about 50 people who were over 70, do you know where to go in your community? And 66% of the people did not know where to go. And to me, that was really, really telling. If we can create enough, educate the community that this is the first place to go with any question you may have, we will have made great strides, and I'll be very, very happy about that. It's a group of professional staff that connect you to the right service. And another thing we hear from consumers is that I get the runaround. I call one place and then I'm sent to another. And the whole idea is that we will have our INA specialists who have been trained and gotten AIR certified to really help people identify what they're looking for and connect them with those things. Find out what their needs are and match the resources we have to that. And do so by doing as much as we can with that first call. If we're unable to address all the needs, then we'll make a warm transfer to the appropriate agency so that we can continue to help this person. And having what we call our software system, or our database, which we call RTZ, and I will probably refer to it as that, as much as I try to explain what it is, I'll be using that acronym. But anyway, it captures the information for us. So, for example, if we take that information when the caller calls in, and we do need to make that referral, we're able to pass it along, and the next person has the basic information. So we don't have to go through those same questions again. Another frustration for people when they have to continually tell their story over and over again. Another great piece about the ADRC is that it's available to all Oregonians regardless of income. So it's not just for public programs, it's for everyone. And I reiterate that because just because you may have means to take care of yourself doesn't mean that you don't face all the questions that everyone else faces. How am I going to care for my mother? How am I going to care for my father? How am I going to care for my spouse? What's out there? What can we do? Do we have to move into a facility? Can we keep them at home? So all those things, which is very exciting to me. I think that's very, very important. We also provide a link to not only public resources, but private resources. So we can kind of be, the ADRC could be that non-biased place to go to get good, solid information. We can provide that information to you, and then we help you make informed decisions. And as Sue Ann said earlier, the ADRC is part of a national initiative. So if you go in and Google ADRC in a state, you will probably find ADRCs in other areas, which is incredibly helpful for adult children who have parents living in other areas. You can look to see what's available and make the connection. And I want to encourage you, if you have questions, please feel free to just type them in.
Christy will also show you later on where there's a place on our ADRC website where you can find other state websites for ADRCs.
Right. So why do we need this ADRC? What we know is that 97% of Oregonians will never access public long-term supports and services. So that means there are a lot of people who just need the information and need community-based services, and they need the information to do what they need to do. they still need help making those decisions when it comes to aging or living with a disability. There are lots of questions around that, and that's what the ADRC can do. We also know that 63% of Oregonians look to their health care provider for information. And actually, the ADRCs are the ones with the they're the experts in aging and community resources, and should be the group you're reaching out to. It would be like us trying to be a medical doctor. It doesn't work. So just creating that place where everyone knows to send people to get information regarding aging and living with a disability, and finding those community resources. So we're working closely with the medical community too to educate them about what we do, and that we can be a support to them as well. By referring people to the ADRC, we're able to take care of that social side that people need, in addition to the medical piece. We also know that 1 out of 5 consumers who contact an APD office or an area agency on aging for Medicaid are not eligible. That doesn't mean they don't need services. I can remember with the meals program, we had a lot of people who did not qualify for Medicaid, but they were making really tough decisions about what they could afford and what they couldn't. I mean, can I buy my medication? Should I be buying food? So there are people that can fall through the gaps. While they're not able to qualify for Medicaid, they still need those community-based supports to help them get through. And another really, really important reason for the ADRC is we're the ones who can fill that void. Why the ADRC? Again, we're really changing, and it's a culture change, really. It's moving away from focusing on eligibility. For so long, we would talk with folks and find out about them and say, you know, we don't have any programs for you. And it's not about that anymore. Well, if you qualify for those programs, we'll help you get connected. However, a lot of people, we focus on the consumer. So it's, what do you need at this point? What's important to you, and how can we help you? So really looking at what the person needs, a person-centered approach is what it's called, and really taking that into account and helping the consumer find the resources, figure out the information, and let them make the decisions. The other part of the ADRC is really moving from experts working in isolation to working in a more, working as partners and coordinating what we do and cross-training and having regular communications. And I can tell you, working with in the Area Agency on Aging, I didn't know what Centers for Independent Living were. Not until we started doing this ADRC work and really bringing these entities together and talking about what services they provide and who they serve and how they do it, and then creating relationships so that when that consumer calls, no matter if they call the CIL or they call an APD office or they call an Area Agency on Aging, we know if they really do need to speak with the CIL, we're able to make that connection for them. Again, capturing that initial information and passing it on to make it as easy and seamless for the consumer as possible. So really, it's that person-centered focus. So here are the core services of the ADRC, and many of these things we've been doing for a long time. If you look at all 3 of the core partners that I have been talking about, they've been providing, obviously, information assistance, options counseling in some form or another, not as formalized as we have now, but in some ways. We also provide access, as I said, to public and privately funded long-term care services. Prevention and early intervention, really helping people live healthier lives, connecting them earlier with things that will help them age well. Transition supports, and that's all about making transitions from one living situation to another. So let's talk a little bit more in depth about information referral. And as I said before, it used to be that INA staff was kind of an entry-level position. And it really is a very, very important piece of the ADRC. And what we have done is required that all information and assistance specialists do get ADRC certified so that they take this formal training, and it's quite comprehensive. The study guide is, I think, well, the book is like 500 pages. It's significant. So we really are professionalizing that whole service. When you call into an ADRC, they provide the information based on your needs. So we're not going to give you a bunch of just general information, which I think may have happened in the past a little bit, but really focusing on your needs and your personal situation and getting you the information you need. The INA specialists also are really good about talking with people and recognizing situations. What we find often is that people will call in with one need, and as they begin to talk, we realize that there's a lot more going on in their lives that they could probably use help with. And that's when the INA specialist will then pass them on to an options counselor. At that point, what is an options counselor? It's someone, a trained staff. Again, we have our own Oregon curriculum, and there'll be a new national curriculum coming out as well in the near future. But really, this training is a 3-day comprehensive training. Sue Ann actually does the training. Do you want to speak a little bit about that, or?
Basically, it's working with folks. The first day is kind of an overview of ADRC in general, and then of options counseling and what the elements and pieces are, because it's actually a service, and it's a defined service. And then the second day, we spend a lot of time on active listening skills, documentation, making sure we talk about person-centered assessments and what that is. So as Christy mentioned earlier, it's moving from that eligibility focus to really getting to know about the person and then working with them about what's there. And then the third day, we spend talking a lot about stages of change and how to motivate people or figure out what stage they're in and how to help them move from one stage of change to the other, and then also family meetings and a little bit about conflict resolution. So it's pretty informative. And then we have one day for the supervisors. They come the very first day of the regular staff training, and then they have their own day about how to help implement and support the folks that are doing options counseling.
Great, thank you. So really, the options counselors help consumers find the information and services they need. Again, this is done by sitting down and talking with them about what's going on in their lives, what they're looking for, and how we can make that happen. And we don't inundate them with a ton of information, but really take the information that they are giving us and look for ways to meet their needs. We don't make the decision for them. We provide them lots of options about what's available in their communities, and that varies from community to community. But that options counselor will know what's available and be able to provide them lots of decisions or lots of information. And then they talk it through and help them make an educated decision about the services and supports that they may need. Again, we make referrals to both public and private services. It can vary consumer to consumer, and it's our obligation to show them all of the services that are available. You can contact an options counselor in many ways. You can do it, the options counselor can visit with you over the phone with the consumer. They can meet in person at the office of the ADRC, and that, when I talk about the ADRC, I mean any office of one of the core partners. It could be an APD office, a SIL, or an area agency on aging, whoever's a part of that local ADRC. They can meet in the office, or they can come to people's homes. A new piece, too, I think, that has changed over the last 5 years is the follow-up piece. So when consumers meet with options counselors, they'll develop an action plan. The person will decide what they want to do and how they want to move forward. And after 10 days or so, the options counselor will follow up to make sure that everything they talked about in that meeting is happening, to make sure that those referrals were done, that the services that were suggested or recommended, those people are following up and doing what they had outlined in their action plan, which I think is a critical piece to make sure that those connections are made.
Yeah, we want to make sure that people actually get the services we refer them to, and if not, help them with whatever barriers are coming up. And then the last piece of the options counseling is that future planning. So working with folks with what's happening right now, but in that decision making, helping them remember to think about the future. You know, so okay, this is a good plan for right now, but if you make this decision, what happens 6 months from now? If you make this other decision, what happens a year from now? And really helping them get through the crisis that brought them to us in the first place, but also think about the long term.
Great, thank you. Work piece. And I talked about prevention and early intervention, and this is connecting consumers to programs that can help them live healthier lives. Again, these vary community to community, but your Aging and Disability Resource Connection in the community will be able to connect you with these things. So information on programs such as Living Well with Chronic Conditions, Tai Chi, walking programs, anything else that might be available in your community. Another thing, you know, getting people to be proactive.
We had a question here about options counseling, income eligible. No, options counseling, none of the services, the core services, are income eligible. So options counseling can be for anyone, and there is no charge at this point, and it can be for anyone, whether they have money or not. Good question. Thank you for asking.
Yeah, great question. It is for everyone. A family member, yeah, anyone. So,
family member, caregivers, consumers of services, everybody.
Oops, hold on. Transition support. This is another core service. Helping people make transitions in living situations successful. And as you know, coming out of a hospital, going home, there are things that can be put in place to ensure that that transition is successful. For example, making sure they have transportation to follow up doctor's appointments, making sure their medications are taken care of, that kind of thing. Returning to home from hospitals, I just said, but also, you know, moving from a home to another situation. When you're faced with an aging parent of having to make that decision because they're no longer safe in their home, and maybe you couldn't get in-home help, whatever the case may be, talking with an options counselor, they can really define for you what the different organizations or housing, facilities do. For example, tell me about a foster home. What does an adult foster home look like? What services do they provide? You know, what level of care? Is it something my parents should do? What about an assisted living facility? So you have this expert who works in this field all the time, really kind of mapping things out for you and sharing information so you can make the best decision possible. And that's what it's all about. And it may change, but it's a wonderful resource for you to have those hard discussions.
So we have another question about, the question is, can we call ADRC to inquire about eligibility for Medicaid benefits, or do we call another state agency? The ADRC is made up of several partners, and so in essence, when you call the APD office, you are calling the ADRC. And ADRCs work differently in terms of who takes the calls and how they take them, but you could start out calling whatever the 1-800 number is for the ADRC, and you will, if you're looking for Medicaid eligibility benefits information, that person, you know, whoever answers that phone at the ADRC phone answering place will get you to the Medicaid agency.
So you can use the basic contact information to get there. So contacting ADRC will get you to the Medicaid.
But Medicaid is also a partner, so you can still call them directly.
Right, right. And I know that kind of gets complicated in your mind, but the ADRC is kind of the brand and the overreaching umbrella of all these agencies. And what we're trying to do for the consumer is make it really easy for them to access any type of information. So using that ADRC name and the 800 number, and you can use it as well to get you what you need.
And we're hoping that the partners, you know, some of them already have phone systems where they can do what we call a warm transfer, which is if they're giving you a referral, they actually put, you know, have you on the call, and then they call the other person and connect you personally. Some of the phone systems aren't quite ready yet to do that, but that's the ideal at some point we hope to have happening.
Mm-hmm. Thank you.
The other place that people can look to for information about the transition supports to facilities is the MOVE, Making Oregon Vital for Elders, and they have a lot of information on their website around the person-centered. How do you find person-centered facilities? What kind of questions do you ask to help make sure facilities are person-centered?
And the final piece of the ADRC is we really do a lot of marketing and outreach. Again, trying to educate the consumers and the public that there is one place to go. You don't have to remember SIL or Area Agency on Aging or APD offices. You don't have to remember any of that. If you could just remember ADRC, that is the first place to call. That's the place to go. And they will get you to the proper, to wherever you need to go. And again, I go back to people not knowing. We all work in this business, and it's what we do every day. But there are people out there who they don't like to think about this, and they find themselves in situations where they need to make contact. And so I think we all have to continually reach out and share with people what the ADRC is, what it's all about, and reiterate to them one name, ADRC, one phone number, 855-ORE-ADRC, and one resource database where they can go and do searches, and that's adrcoforegon.org. And then I think we need to tell them, people tend to believe that we can do this big rollout, we can talk about the ADRCs, and we're done. And as you know, with anything, we have to continue to tell people. Tell them over and over and over again, and we have to do it on a regular basis. And stay in front of them as much as we can with the name and with the phone number, so that we become the target, so to speak, of aging. So when they think of aging or living with a disability, they're like, yeah, that's the number I need to call. It's that ADRC place.
And here's a perfect question, Christy. Have you developed a brochure that we can order, or is that a work in progress?
We have lots of brochures. We have an ADRC brochure. We have one about options counseling. And we would be happy to send them out to you. We have them both English and Spanish. If I can get them to you, feel free to shoot me an email. My contact information is at the end of the presentation. But your local ADRC should have those as well. So if you know who that is and you know the contact, call them and get some brochures. Otherwise, we can ship them out to you.
So the APD offices, the AAA offices, Area Agencies on Aging, and the Center for Independent Living should all have some of that brochure material, as well as they're running ads. Christy's doing all kinds of marketing and newspaper ads and radio ads. So here's another great question. So is there an overlap between the info and referral system or the information that we provide through ADRC versus the 211? What's the difference, Christy?
So there is a difference. And so this is the best way we can describe the difference between ADRC and 211. 211 really provides information, if you think of it as an inch deep and a mile wide. So they provide information about services in a community from birth to death. And basically it's a referral. You call, you have your question, you get your number or who you're to contact next. With the ADRC, because of the population we serve, we like to say we're more like a few, we're not as broad, but we're deeper in the fact that we can take you, we can provide you just a phone number and the information you need, or we can walk you through the process. So you can meet with an options counselor and they can provide the information and show you all the pieces that you need for your plan and really walk you through kind of your guide on the side, if you will. That person who helps you go through really explains what the different services are and what they entail, and lay that out for you to help you make that decision. Another difference is that once you make contact with the ADRC, you're able to call that same person back and talk with them. So that's the main difference where we do have the same resources. The way we handle things are a little different.
So another question came in, how long does it take from the first contact until someone is able to actually start services? And that's going to depend. I mean, to us at the ADRC, they're starting services the minute that our INR person picks up the phone. And so, I don't know, what do you think, Christy?
Well, you should get a call back. The goal is to have a call back within, if you call an ADRC and you don't talk to someone that day, you should have a call with the next business day. But that would depend on what you're looking for, what services you need, what's available in your community. But the process should start, as Sue Ann said, the minute you call the ADRC and are connected with someone. Great question.
So, and again, you know, what services you're being referred to, there will be still some eligibility requirements and some timelines and things like that. But the service actually starts the minute you start talking to somebody at the ADRC. And with the options counselors, if you get referred to an options counselor, they can walk you through whatever you need up to several months of time.
So is this helpful to you, I hope?
So are the ADRC brochures distributed to physicians' offices, hospitals, senior clinics, senior centers, congregate meal sites, and anywhere else where older adults already are, rather than having to come to us, for example?
Well, that's a great question, because as an ADRC, we want you to be we want those brochures out in the community. They don't do any good if they're sitting, it's like a library keeping all their books. We can't do that. And so that information should be taken out to all of those places that you've listed here, physicians' offices, hospitals, clinics, senior centers. And we do encourage all ADRCs are required to have a marketing and outreach plan. And part of that is going out and delivering those promotional materials to those entities. But beyond that, really sitting down with them and talking about the ADRC. Brochures are great, but they're best when they're used as a follow-up to a presentation or sharing that information. So absolutely, those brochures need to be in every nook and cranny of your community.
We ask the local partners to do this in each of the ADRCs, because this is about building relationships with the other community partners that are out there. And so one of the things that we ask the options counselors to do, for instance, is to, you know, meet with folks in the different facilities and give them brochures and let them know they're there. The transitions coordinators meet with the folks in the different hospital discharge planners. So it's part of that whole, you know, helping the community become more partnered and getting rid of the silos and working with folks.
Right. And, you know, you can also, if you're interested, I know we have a wide variety of people on the phone today. You are more than, I encourage you to call your local area agency, SIL, or APD office about the ADRC. Call your ADRC and ask them to come out and do a presentation.
So I'm not sure, this next question is, if they call INR, what is the standard of how quickly we'll get back to them? I believe, or else somebody's saying that their local standard is they get back to them within 2 to 3 business days.
Yeah.
I believe we're aiming at 24 hours, so the ideal would be 24 hours. So I'm not sure if this is somebody saying that maybe this particular organization isn't quite at the ideal yet. Is there a gatekeeper brochure, Christy?
Yes. There is a gatekeeper brochure. Again, if you contact your local ADRC, they should have ADRC or gatekeeper brochures for you.
So any of the ADRC partners should have the gatekeeper brochures,
or be able to access them for you.
So the typical length, what is the typical length of a call? That's pretty hard to say, because some calls can be, you know, 2 minutes. The person calls, they know exactly what they want. The INR specialist looks it up and gives it to them, and that's it. We try to get a little bit of information from them, you know, a few demographics if they'll give it to us. But other INR calls, I don't know that there is a typical length. I would say that there are some call centers who say that a call probably shouldn't take more than 7 or 8 minutes, but then there are calls that do take more. So I don't know. If anybody's listening and has an estimate and wants to type it in, we're happy to send that out. But it just depends on the INR specialist and the situation and whether the person really knows what they need or whether the INR specialist is going to help them with what they need. Because sometimes they call in and think they know what they need, but in talking with the INR specialist, it's clear that the other things are happening, and so then the call becomes longer. So here's someone, the agency provides case management to adults with DD and ID. At what point would it be appropriate for our case managers to reach out to ADRC? Maybe we have a customer who is aging or has physical disabilities who needs more services than what we're currently able to offer. So yes, as soon as you figure that out, as soon as you realize that they may need a little more than what you have, I would try to connect with my local ADRC partners. Christy?
Absolutely. And, you know, I think it would be great if you haven't already connected with your local ADRC to do so and have them come out and start talking with your staff about what they do and what services are available so you can really begin building that relationship. But, yeah, anytime you have questions, things like that come up, go ahead and contact them.
Yeah, one of the things we encourage a lot is that the different partners do cross-training with other agencies. So, for instance, folks from the different ADRC partners might go out to a CCO or to your local doctor's offices or to your agency that does ID/DD work, and you do cross-training. You know, here's what we do, and then you talk to them about what you do. And so everybody begins to know what everybody else is doing. How long is the actual phone call with the consumer? Again, that was like the question we had before, and it can go from 2 minutes to an hour and a half. I mean, if you actually end up doing options counseling on the phone with the person, it could go a long time. So the phone calls are different. You know, I know Multnomah County has a call center, and they try to keep calls at a little bit less time. Northwest probably has different levels.
You know, I think what they're going to do is we're going to try to get the situation, the ball moving. And again, it could be a quick, here's your local Meals on Wheels phone number. Or it can be someone who has something much more detailed. So it really does vary, but I can tell you that we allow in most cases, the INA staff to take as much time as they need to get the consumer what they want and get things situated. So it's not like we say your call has to be within, you know, if you're an INA specialist, your call has to be within 2 or 3 minutes. There's nothing like that with the ADRC.
No, again, it's all about that person-centeredness and really getting the information we need to really help the person. So there isn't sort of a typical time of a call or you know, the length of the phone call. I've talked to people who've ended up talking to someone about INR for 30 minutes or more. So it's partly your local agency and you know, protocol. Okay, would you mind repeating on the age range for a person to start services or access the ADRC?
Well, that's really, you know,
there is none.
The ADRC, yeah, the ADRC is really for anyone. It could be a caregiver, it can be an adult child, it can be anything. So people calling to find out information, we'll provide information to anyone who asks. And I think for each agency, it varies. For AAAs, it's 60 and over for a lot of things. For some other programs, it's 65. For SILs, I think they cover the broad range of people with disabilities. So again,
so in terms of the ADRC core services, again, the information and referral and the options counseling, it can pretty much be any age, but there definitely are some agency partners who have age-specific services.
But again, we can provide the information and the referral and the options counseling about what's available to anyone who wants it.
So here's a question about RTZ. How do we keep it updated and effective? That's the ADRC system, the statewide system, and we keep it updated and effective by the folks, the INR specialists and the options counselors who are working with consumers, then need to put their documentation into the system. And if they're doing that and you know, they're going through training and they know what's supposed to get entered, then the system will be updated and efficient. And we are beginning quality assurance type measures to begin to look at that data.
Yeah, and if you're talking about resources, which you may be, if you're looking for resources, each local entity is responsible for reviewing their resources and making sure they're updated on an annual basis at least. But I also like to tell everyone who uses our website, if you go on and you're doing a search for something and you see that a resource in your community is not coming up, you have the ability to shoot us an email and let us know about that, and we would really, really appreciate it. As many of you know who try to keep your resources updated, it's a huge, huge undertaking, and any help we can get from the community we welcome, because as I like to say, it's not our website or our resources, but it's ours as Oregonians, as all players, as everyone. If we can all work together to keep that updated, the better it will be. And we want a robust system. So if you see things, again, that aren't listed that you think should be, or you see something that's outdated, we appreciate the feedback. However, currently we're having the local areas keep they're responsible for keeping their local resources updated.
And we encourage the staff in the organizations that are partnering in that area to stay in touch with that one database person and let them know, like Christy said, if there's an organization you know that's changed information or just come into the area. And then the other thing is making sure that the keyword search, that people are looking for things and that the database person has entered those keywords. So if you're not finding something, you need to just check in with them. So thanks, great questions. We're going to get back to we'll get back to the PowerPoint in a minute here. Oh, okay. So we're hearing from a couple of agencies that our response about the call length was correct. That's pretty much the way people do it. Thank you. Okay, are HIPAA laws affected when someone calls and gives names? You know, this is one of the things that we have on our radar screen and have many conversations about. And most of the time with the INR information, we're not necessarily, HIPAA laws don't have necessarily just to do with names. It has to do with medical information. And a lot of times we aren't actually getting medical information. So we are looking at HIPAA related issues because of the fact that it's a statewide database, and the options counselors often get more information. But I know that there are some agencies who have people sign releases, and it is something that the database folks are talking about.
Yeah.
It's a tough question, but it doesn't just have to do, it's not just names and particular information. It has to do with medical information. Are there state standards regarding the use of a person-centered approach in agencies that may be used to an eligibility focus?
May be used to.
Yes, we do have state standards with the ADRC that we're training the options counseling folks, and the APD agency or the information that we're using to train folks around that person-centered assessment is the same information that could be used. It's switching your perspective from the task orientation to a relationship-based orientation. You still do the task. You still have your checklist there around the eligibility requirements, but you're actually doing the assessment and asking the questions in a much more person-centered way and getting them to talk and getting your information in more of a conversational way as opposed to kind of grilling and asking them questions. So I'm certainly willing to talk to people offline about that.
Well, and we certainly have standards for the ADRCs. For other agencies outside who are focused on eligibility, we're always willing to talk about the person-centered approach and how we address things. And so I guess, but if it's, and we can only do so much with, you know, we can't really influence other agencies. I mean, we can't determine how they're going to conduct business.
Well, and that's a piece of the partnership on the local level, as your agencies sort of decide that and decide on your referral protocol and sort of go through some of that as we give you state guidelines, and then you guys do that locally. We've got Amy Camp from ILR saying that they get back to options counseling referrals within 24 hours, and they do not have a partnership for their INR services. So their policy is 2 to 3 days. Thanks, Amy. Okay, the Mulco helpline average talk time last month was 5.5 minutes for information referral. Thanks, Monica. That's great. So the average Multnomah County helpline talk time last month was 5.5 minutes for those of you that were asking. Okay, our services that are provided by private companies vetted by the ADRC. We have an inclusion-exclusion policy because we do have both public and private resources in the database, which is part of what makes our database different than a lot of the other ones. And we do have an inclusion-exclusion policy, and we do vet the private businesses. They have to have been in business for a certain period of time, and they have to give a copy of the license and have other information for us. That information is on the website. There is a copy of our inclusion-exclusion policy. But yes, we don't just put people in there because they say they're good. They do have, there is a vetting process. Great question. Thank you. Are you finding that by integrating a person-centered screening approach, the way consumers choose to access services and the types of services they're choosing to access are changing?
Oh, I'd have a hard time answering that at this point.
Yeah, we could take that question to Elizabeth O'Neill, who is our teammate who does evaluation, and we are hearing in the consumer satisfaction surveys that people are very, very happy with the home visits, the options counseling process and procedure, and the facilitation of their processes. So I do believe it is making a difference, but we don't have any quantitative data around that. It's mostly qualitative. So it's mostly anecdotal stories and things like that, but we can check on that for you. Thanks, that's a great question. We think that we will be finding that more and more. It's a great question. Thanks, Monica. It looks like the longer calls for the Multnomah County Helpline can be 12 to 15 minutes. Thanks, Monica. Is there a PDF version of the ADRC and options counseling flyers that we can use as attachments to emails? Yes. Yes. Contact Christy. Do most ADRC INR staff also receive options counseling training? I don't know about most, but quite a few of them do. And the folks that do come through options counseling training say it's very helpful. I would say at least a third of the INR staff out there across the state definitely have been through the options counseling training, if not a half of them. I think it's a great idea and it seems to be helpful. Are there not quite sure what this question is. Something about options and urgent services such as home health needs and post-hospital follow-ups. And those, yes, I mean, the INR folks and the options counselors would help people get to urgent services. That's part of what the INR and the options counselors' jobs are, is determine whether it's something that's urgent or whether you have time. So I'm not clear on that question. Am I hearing correctly that INR specialists are also providing options counseling, or are they referring to agencies?
Well, options, well,
some do.
Some do, some don't. So information and referral specialists take that information, and I think based on the information they're getting from the consumer, they may contact an options counselor to take it at a certain point. And so that referral is often done within the agency because the person taking the call, the agency taking the call usually has options counselors trained. So if that's answering your question, that's it. In some areas in different states, the INA folks are actually options counselors too. So on a given day, for example, they'll take INA calls, and if they get consumers who want options counseling, they will schedule that on their calendar for the day they're doing their options counseling work, and will actually go out and do the options counseling. So it can be set up in a number of ways.
Yeah, it's up to the local folks, and the INR specialist, you know, if it's a AAA that's taking the calls that day and it's a person with a disability, they might refer to the Center for Independent Living for their options counselor to take the call. Mm-hmm. So it just depends on the situation, and it can be any of those. Hopefully that answered your areas. Yeah. Hopefully that answered your question. Okay, I think we're gonna we've about answered the questions, but we definitely still have a little bit of the PowerPoint left to go. So I'm gonna let Christy get back to the PowerPoint here.
I'm just gonna jump ahead. All I have is basically you know, the ways to contacting the ADRC, the toll-free number. When you call the toll-free number, you'll be asked for a zip code and you'll be routed to the nearest agency. Or if you don't get to your nearest agency, you might end up at an overflow. In the phone system, you could end up at a different ADRC, but they will get you connected to the correct one. The other way is also through our website, and I really quickly want to walk you through, just kind of give you a glimpse of our website. I'm hoping that, right click.
Yeah, I did.
Oh, you did. Let's see. Where's the hyperlink? There it was. We're trying to get, you know, it's like one day it works, the next day it doesn't. One morning it works, the next day it doesn't.
No.
Can we just go to, anyway, I hope most of you are familiar with the ADRC website, but if you're not, I would encourage you to take the time to go in and look at it. We just rolled it out. Well, it's been up for several years, but we just revamped the whole website last spring. I believe that's right. The years kind of start running together. But it's a great resource for folks to go to. Let's see, there it is. So I just want to talk, I have 2 minutes, so I'm going to be really quick. Up here, the site search, this is an area for you to go on that will actually search the content on the website. So, for example, if you're looking for a meals program or food in your area, or not in your area, but generally programs or general information, you could type it in here and it will take you to the area on the site where you would find that information. Over here we have a language that we have, it's available in 7 different languages. The website, we use Google Translate. While we know it isn't ideal, it's affordable, and we felt that it was better than nothing. So that's available as well. And way over on the other side, they don't see this, right?
Right.
So way over here, you can adjust the font size. I want to call your attention to the planning tool. This is a booklet that you can print out that is, I think, really, really great. It talks about the costs of long-term services, long-term care, and also helps you have conversations with your family about your wishes and how to move forward as you age. And so I'd really encourage you to take a minute to look at that.
It's about 64 pages, so a lot of folks are downloading it to give to clients.
Yeah. So the page is really easy to navigate. It's just these 4 quadrants. If you go down to the bottom of the page, you can see what the topics are under each area. So that's really, really helpful. Okay. So Explore is really talking about the content. So if you have questions about programs, this would be the area to go into. Yeah, you can hover over things when you see words, things that you're unfamiliar with. It gives you a little description. Also, in the website, we only went down 3 levels. So if you go to long-term services, we just have this next level so you can get more into detail, but really trying to keep it simple and easy for people to navigate, because in the last website, people had difficulty. It was easy to get lost. The search. This is a great tool for searching for resources. So, for example, if you're looking for, let's say you're in Corvallis, I think that's Corvallis, and you're looking for food, you can do a search, and up pops, first of all, this little map on the side, but then you also get a listing of what providers are available in your community. Down the side, you can narrow your searches by what is specifically you're looking for. You can also go to this section right here. You can click the ones you're interested in, and then you can say go, oops, oh, whoops, I biffed it. Sorry about that, people. You can go up and you can get a side-by-side comparison. So if you go up to compare, right here, and click.
But you have to put your address in, right?
Not yet, I don't think.
Oh, there you go.
Then you can do a comparison. This is really a great feature when you're trying to figure out one versus another, what might be more beneficial. Then we can get out of that one. And if I were to enter an address here, so let's enter my home address. Oh, yeah. I don't care. Nope. You could actually do a search, and it will tell you.
It will come up with what's closest to your
So
address.
you can see your distance by the address you enter, whatever that might be. You can find out which entities or which organizations are closest to you. So that's a really great feature as well. Connect is really easy. This is just about connecting you. If you're looking at the state, you can click on the county you want, and it will bring up the contact information for that county. And as Sue Ann said earlier, there's a way to connect to ADRCs nationwide, and this would be the place that you would go. So that is it in a thumbnail sketch, really quick. We thank you so much for being on today. I really look forward to your input about ways we may want to improve the presentation. We do this for community members and don't go into quite so much detail, but let us know what you thought, and we're happy to share this with you. For those of you who are ADRC partners who make presentations in your community, we're happy to provide this to you, and you can tailor it to fit your needs. So give us a call.
We have just a couple quick questions here. Is there an interpretation service or an interpreter service at the ADRC?
And each ADRC should have the ability to connect with, if they don't have someone who can speak the language on staff, they should be able to connect you with a language line that would be able to assist in that. Okay?
So I just want to thank Christy a lot and thank all of you for your great questions. And we're happy to do this again or do it in more detail. We did record this, and we will be doing a transcription of it and getting it all up on the website as soon as we can. We will watch for a link from Lori Watt that will give you a Survey Monkey so you can let us know how we did. And Christy's address is on the how to get hold of her if you need brochures. The next webinar will be July 14th. And I will send out those registrations next week probably, and it'll be about fall prevention. So thanks again, everybody. We really, really appreciate it. Have a great afternoon. Thank you.